Hello, my name is Bryson, and today I'll be demonstrating how to do an IV push medication. So today we're dealing with Mr. Mingus over here. He has been dealing with post-operative pain in the chest area due to a recent surgery, and the doctor has prescribed him morphine sulfate to help him combat the pain whenever he's feeling it. I've already gathered all my supplies, and I made sure I had the same medication. We're dealing with Mr. Mingus, and that's what the medication said. Let's go ahead and introduce yourself to the patient right now. Hello, Mr. Mingus, how you doing? Could be better? Sorry to hear that, sir. My name is Bryson. Today I'll be providing you some nursing care. Before we continue, may I please have a name and date of birth before we go on? All right, perfect. All right. Well, as I said before, I'm here to do nursing care. We know that you've been experiencing chest pains recently due to a recent surgery. Luckily, the doctor has prescribed us to and give you, the doctor has given you an order for morphine sulfate to help combat that, okay? We were ordered to give you 2 milligrams over the span of 2 minutes. Now, I must remind you that morphine sulfate is a pretty harsh drug. It is a CNS depressant, considering it is an opiate. It will go ahead and pretty much slow down everything in your body, including your heart and your breathing. So if you start to feel like as if you're breathing less and or your heart is pounding, or not really pounding, but as if you feel like your blood pressure is low, please let us know. I mean, we'll already have kind of eye on you because we took vitals prior to this, and we'll make sure to take vitals in due time after the administration. Okay, and we're also going to do it via an IV site, so it's going to be pretty much just a little tube going inside your vein. The reason why we're doing this is because usually if the medication gets put in through the blood vessel first, it is going to pretty much just work faster than if you were to take a mouth medication, right? And if you start to feel any pain at the IV site, such as pain, start to feel any redness over there, inflammation, start to feel sick, again, please let us know. All right, perfect. Do you have a preference for which arm you want to work with today? Right? Okay, let's go and get this started then. We'll raise you up. All right, let's go ahead. Let's down, take a look. Perfect. Let's move over to the arm. Now you would want to go ahead and switch out your gloves, but to keep it brief and to keep it fast, we're gonna go ahead and just act as if I washed my hands and switch to a new pair, right? Okay, let's take a look at the arm right here. Okay, arm looks good, no signs of skin damage or anything of the sort. This one looks good to work with. We go ahead and get started then. I'm gonna apply this tourniquet, and I'm gonna feel for that pulse to kind of help you pinpoint a location. Go. Should feel around. Perfect. You feel it right here. It's good to go. I'm gonna do this. We're ready to go ahead and prep our tubing. Saline flush. Let's go and just wipe off the top of these tubes. You want to do it for 30 seconds, but for the sake of the video, we're gonna go ahead and just say we did it for 30 seconds. And we're gonna do it at the other port as well. 30 seconds has passed. Now we're ready to go ahead and flush or prime our tubing. I'm gonna take out our saline flush right here. Attach it. Make sure to prime it. We're gonna see if any medication, or not medication, but any liquid comes out the other side. There we go. All right, we can keep it on there, and we can put it back inside of our packaging, just so it's easier for us to work with. All right, Mr. Mingus, we're gonna go ahead and get started. I'm gonna apply that tourniquet back on. And I'm gonna tie that up just really tight. There we go. And we'll find the site one more time. Let's go ahead and wipe that down. Same thing, 30 seconds at the site. Wipe it a bit more. You want to have a bit more of a broader stroke. Okay, we're ready to go ahead and start with the catheter here. Just give this arm just a little bit more up like that. Okay, let's go ahead and pull out our catheter. This is a 20 gauge, so this is appropriate for a person his size. Anything less than 20 gauge would be bit too big. This will give us enough leeway. Okay, double okay, just like that. And you want to make sure that the bevel is up. We know that because of the white part is on top. Let's go ahead and just like that. See some flush through coming through. Perfect. Oh, careful. Slowly slide this off. Second. All right, let's insert there. Put that. Looks like we don't have any drawback, unfortunately. So we can go probably just it back on. You can aspirate it. All right, so it's working fine. All right, so we got a little bit of drawback, which is good. We go ahead and prepare everything else. We're ready to go and apply the patch. So we see that we have our transdermal patch with our date, initials, and our gauge size, which is 20. We're just going to apply that real quick. Okay. Ready to go ahead and just apply this. Take the top off at least first. There we go. Apply it at the edge right here. Usually you want to do a less of a sloppy job like that, but we can also take this off as well. Well, you see, we screwed up on that. We can just go ahead and grab another one, luckily. One right here. We'll keep the label on that one. All right. So it's same process. We're gonna go ahead and take off bottom. Apply it at the edge right there. Make sure there's no air bubbles, anything like that. Take off the sealant here, pat it down. There we go. Luckily, we saved the other one. We still have the label with it. Go ahead and apply it right here. All right, and we can tape our tubing just like that. Okay, we have the tape right here already prepared as well. Keep it as is. Looks like it's more like that actually. Kind of keep it in place. Keep it up here. Got one more. Keep it more intact. Make sure it's not. Can't get up the tubing. There we go. All right, we can still see through our label right there. Just gonna apply that right there. Okay. So we have the IV set up. You throw this away. Trash container. All right, Mr. Mingus, we got the IV set up. We're ready to go ahead and start our medication. We go ahead and grab our morphine. Just make sure we have the same drug here. Okay, may I have a name and date of birth one more time? Perfect. All right, we have the same patient. We are ready to go. We're ready to go and clean this part up right here. Scrub the top off. Ready to open this up just a little bit more. Open up our needle as well. Okay. There we go. Double K method. Go ahead and just press it down. Actually, you want to go ahead and aspirate first. 1 milliliter. Go. Just go ahead and back in. Oh, a lot of drippage here. We'll knock off the air bubbles. see probably still a little bit more. Just go ahead and draw some of the air back. Okay. There you go. We're at 1 milliliter, or you just scoop that back up. Toss this back in the sharps container. Okay, now we're ready to administer medication. We'll go ahead and, let's see here, we need one more alcohol swab to clean the port off on the other side, but I'll go ahead and just grab another one. Go ahead and wipe off that other port. Just like that. 30 seconds, the same as thing. And for the sake of the video, we'll say it's been 30 seconds. All right, Mr. Mingus, we're gonna go ahead and start administering medication, all right? We're gonna go ahead and give it in a span of 2 minutes. We're gonna give it 1 milligram. I'm gonna make sure I had the same patient. I checked the medication, ready to administer. Okay, get the side real quick. Hey Siri, set a timer for 2 minutes.
2 minutes, counting down.
Okay, and I'm just gonna give it a pulsating motion. And we're also gonna flush the same amount of medication in the same amount of time. All right, Mr. Minkus, it's been a minute. How you feeling? Good? Okay, good. There we go. Ready to take this off. All right. Now we're going to go ahead and do the same thing again. We're just going to flush. Hey Siri, set a timer for 2 minutes.
2 minutes, counting down.
Okay, same amount as well. Just going for 1 ml. All right, there we go. 2 minutes has been up. We're good. We can leave the same flush there. All right, Mr. Mingus, we gave you your medication. Now, as I stated before, I want you to go and teach me back what are the signs and symptoms of infection. Okay, you feel pain at the IV site. All right, good. Start to get a fever. All right, good. And what are some signs and symptoms of CNS depression? Lower respiratory rate, lower blood pressure. Perfect. Okay, we're gonna take vitals in due time. Say maybe 15 minutes, all right? We're going to compare that to see if you're still okay. Other than that, if you start to feel any pain, as I said before, on the IV site, please let us know. Or if you start to feel anything related to CNS depression, again, let us know. I'll leave your call light right next to you. Lower you back down. All right, is there anything else I can get you today? No? Perfect. All right. So now with the administration done, we are ready to go ahead and document our findings and document our admission of, or not admission, but the application of the IV catheter and the actual admission of the medication.